Obsessive-compulsive disorder, OCD. OCD is characterized by intrusive thoughts called obsessions that lead to repetitive behaviors called compulsions. These behaviors are performed in an attempt to reduce the anxiety caused by the obsessions, but often provide only temporary relief. It's like your brain has a keep it clean button stuck on repeat. Therapy and meds help loosen that grip so you can enjoy life without rearranging your sock drawer every hour. Attention deficit hyperactivity disorder, ADHD. ADHD involves difficulty with attention, hyperactivity, and impulsivity. People with ADHD may struggle to focus, sit still, or think before acting, which can impact their daily functioning. Think of your brain as a squirrel in a peanut factory, constantly bouncing around. Meds and strategies help corral that energy into productive channels. Depression. Depression is a mood disorder that causes persistent feelings of sadness, hopelessness, and loss of interest in activities. It can affect how you think, feel, and handle daily activities, and may lead to physical symptoms as well. Seeking professional help from a therapist or psychiatrist is crucial for accurate diagnosis and effective treatment, which may include therapy, medication, lifestyle changes, and support from loved ones. Anxiety disorder. Anxiety disorders involve excessive worry or fear that is difficult to control and can interfere with daily life. This can include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Your brain's like a worry machine on overdrive, spinning tales scarier than a haunted house. Therapy and deep breaths help dial down the fear factor. Bipolar disorder. Bipolar disorder involves extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. These mood swings can affect energy levels, activity, sleep, judgment, behavior, and the ability to think clearly. Imagine your emotions are on a roller coaster, but instead of a fun ride, it feels more like a chaotic tilt-a-whirl. Meds and therapy aim to bring some stability to the amusement park in your head. Schizophrenia. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may have difficulty distinguishing between what is real and what is imaginary, and may experience hallucinations, delusions, and disorganized thinking. It's like your brain's holding auditions for a reality show you didn't sign up for. Meds and therapy help bring order to the chaos and turn down the volume on the voices. Borderline personality disorder, BPD. BPD is characterized by unstable moods, behavior, and relationships. Individuals with BPD may experience intense emotions, have difficulty regulating their emotions, and engage in impulsive and self-destructive behaviors. Picture your emotions as wild rodeo bulls, bucking and twisting with every thought. Therapy teaches you to be the cool, calm cowboy in the saddle. Eating disorders. Eating disorders involve extreme emotions, attitudes, and behaviors surrounding weight and food. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. It's like food's the boss in a game of tug-of-war, pulling you in different directions. Therapy helps you reclaim the reins and find a balanced meal plan that doesn't play mind games. Post-traumatic stress disorder, PTSD. PTSD can develop after experiencing or witnessing a traumatic event. Symptoms may include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Flashbacks are like unwanted guests crashing your mental party, and they never bring snacks. Therapy helps kick them out and change the playlist to something less triggering. Social anxiety disorder. Social anxiety disorder involves intense fear or anxiety about social situations, including fear of judgment, embarrassment, or humiliation. This can lead to avoidance of social interactions and significant distress. Imagine your brain's a nervous chihuahua at a Great Dane convention. Therapy helps teach that little dog some big tricks for feeling more comfortable in the crowd. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks. These attacks are accompanied by intense physical sensations, such as heart palpitations, sweating, trembling, and feelings of impending doom. Your brain's like a car alarm that goes off at the slightest breeze, leaving you feeling more frazzled than a cat in a room full of rocking chairs. Therapy teaches you to install a quieter alarm system. Narcissistic personality disorder, NPD. NPD is characterized by a pattern of grandiosity, need for admiration, and lack of empathy. Individuals with NPD often have an inflated sense of self-importance and may exploit others to achieve their own goals. While individuals with NPD may be resistant to treatment, therapy focused on developing empathy and improving interpersonal relationships can be beneficial. Sleep disorders. Sleep disorders involve disruptions in the normal sleep pattern, which can affect overall health and well-being. Common sleep disorders include insomnia, sleep apnea, narcolepsy, and restless leg syndrome. It's like your brain's idea of a bedtime story is a thriller novel with a plot twist every page. Therapy and sleep hygiene tips help rewrite that story into a peaceful slumber. Substance use disorders. Substance use disorders involve the recurrent use of alcohol or drugs despite significant negative consequences. These consequences can include health problems, impaired functioning, and interpersonal difficulties. It's like having a mischievous gremlin in your brain, who's always up for a wild party but leaves you with a hangover that lasts for days. Therapy and support groups help evict that party animal for good. Phobias. Phobias are intense, irrational fears of specific objects or situations. Common phobias include fear of heights, spiders, flying, and enclosed spaces. It's like your brain's convinced spiders are plotting world domination from under your bed. Therapy helps shrink those eight-legged fears down to a more manageable size. Want to know every phobia? Then click on the next video. Thanks for watching.